Let's talk about smoke-free campaign from the FDA because they've embarked on a sensitization campaign to keep a smoke-free environment. And joining me in studio for this conversation is Jemima Odonko, and she's head of tobacco and tobacco products at the FDA. Jemima, it's good to see you again.
Good to see you too.
How are you?
Happy to be back.
Yeah.
Very well, thank you.
That's great. Last time we spoke about smoke-free campaigns, and I learned something from you that the rules don't apply to marijuana. It was just tobacco, so cigarettes and those tobacco-related products that these smoke-free policies talk about without marijuana. I'm hoping to learn something else from you today, but tell me, what's new from the FDA?
So thank you very much, and good morning to your audience. As I said, I'm happy to be back here. The last time we came, we spoke about the need for a smoke-free environment.
Yep.
And the smoke here is a reference to smoke from the burning end of tobacco and tobacco products, as well as, yes. So basically that's,
okay.
So why the need for smoke-free environments? Research has shown that tobacco products itself contains a lot of toxicants, about which we have found 50 of these toxicants to be carcinogenic. That is, they cause cancer, exactly. And if you look at the population of smokers in Ghana, we have just about 5% of the population smoking, with the 95% of us not smoking. However, if you don't smoke and you find yourself within a space where smoking is actively ongoing, you are equally exposed to the dangers in the use of the tobacco products. So the need for this campaign.
Right. So the campaign is no smoke campaign or smoke-free environment. What's the name of the campaign? To enforce
the regulations as part of our mandates, the Part 6 of the Public Health Act, that is on tobacco control measures, bans smoking in public spaces.
Yes.
So smoking is not allowed in public spaces.
That is a policy?
Yes, that's a policy.
Okay.
Instances where facility allows smoking, it is the absolute responsibility of the facility manager to designate an area solely for that. Yeah. And that is to prevent the smoke that comes out of the burning end of the smoke, or the smoke that is puffed out by the smoker to interfere or affect other people who do not smoke.
Okay. So just to be, for clarity, to be sure I'm following what you're saying, we have the smoke-free policy, which bans smoking in public areas.
Very true.
Except facility managers have demarcated a special place where you can go and smoke there. Yes. So that's the policy that you're trying to reinforce, right? But what's the name of the campaign that you're currently...
It's a smoke-free policy.
Okay, so it's the same policy that you're campaigning so that you can sensitize us on what it entails, the dangers.
Second-hand smoking.
Okay,
so
and all
you might say, I don't smoke. However, you find yourself within areas where people actively smoke. So you are equally exposed to the toxicants, the chemicals that comes out of the tobacco itself. And that is quite harmful to the human system. So the need for this campaign.
What do you think are the challenges that you encounter in enforcing this policy?
For the challenges, they are quite numerous. One of them is ignorance from the part of the facility managers and not just the managers, the population. There's so much when it comes to these policies. Even though you have the right to smoke, because smoking is not illegal in Ghana, however, there are regulations to smoking. You can't smoke anywhere in the open space. All public spaces are smoke-free areas. And so it is...
You mean by public places everywhere? The beach, the clubs, in your house, the backyard?
Your house is your private space.
Ah, right.
However, the moment you allow other activities to happen within your space, if a party is happening in your home, it becomes a public space. Yes. Okay. So then you cannot allow smoking. So what the law requires is that if you want to, if your facility manager permits smoking, as I said, it is up to the manager to create a DSA, and there are requirements for discretion. The DSA should be positioned in such a way that smoke from within that space should not seep into areas where non-smoking activities do take place. So when you go to a restaurant, and that facility allows smoking, you cannot create your DSA close to the entrance to the restaurant. You cannot create your DSA close to the swimming pool, because the pool is a public space where people do engage in other activity. You cannot create your DSA within the parking lot because that is a public area. So this DSA should be positioned in such a way that smoke from within that space would not seep into areas where smoking do not take place. And the law also requires that if you allow smoking, your DSA should be solely, be meant for smoking activity. Nothing else can happen there. You cannot ask workers within your facility to offer any service within that space.
Yeah. Wow. Yes. So even if you've demarcated a place for smoking, your workers, those, you know, the waiters and waitresses, yes, they cannot serve you there.
Food there. They cannot do,
you know, that doesn't happen.
And yeah, that is to also protect the workers because they also have the right to quality life.
Yeah.
Exactly. So the law is clear on that. So for some of the challenges, you go to facilities and they will tell you, oh, I don't have an idea of what these laws are. And then also it is the mandate of the facility owner to post the no smoking signages everywhere, especially within the entrance. It should be prominently placed so that whoever walks in there would know that this zone or this area is a no smoking area. So failure to do that is an infraction on the law and it is punishable by,
Okay. And thank you for bringing us that clarity on what really the law says. How can we help? You mentioned that the challenge is the lack of awareness on the part of the public and even sometimes facility operators and managers. How can we help? By we, not just the media, but other citizens who are aware of this policy. How can we help?
Thank you for that. So as citizens, you should be mindful of your environments. So when you find yourself in a space where you find active smoking, the right thing is to draw the attention of the facility manager. In cases where they are a bit recalcitrant, not ready to listen to your plea, you can reach out to the FDA any day, any time. We have hotlines. Yeah, we have.
Let's put that out there. Yeah.
So in case where you find yourself in a compromised situation and you need to reach out to FDA, we have numbers you can reach us on. For the calls, you can call us on 055 111 2224. Or you can WhatsApp us on 055 111 2225, as well as email us on fda@fda.gov.gh.
Okay.
For the offices, we have offices across the country, so you can walk into any of our offices if you are close by. And then we would also appreciate it if you can get some form of evidence, because smoking is done within a period. You might think, okay, we went to this facility, we find people smoking. If you come with some form of evidence, it would really help us to go back to reinforce the tobacco control measures.
Okay.
But if it's just by hearsay, sometimes it's difficult to exactly.
So apart from this smoke-free campaign from the FDA, are there other institutions or agencies championing this cause? Are you the only ones? Is it the FDA alone that's trying to enforce this policy?
It's an agency under the Ministry of Health, so we do a lot of collaboration with our mother agency.
Okay.
We have the CSOs who are out there too. We work with the Ghana Police Service when it comes to the reinforcement of, we work with a lot of security agencies across the borders, because most of these tobacco products are snaking into the country through some of these unchecked borders. So yes, we work with quite a number of people, agencies that help in the enforcement of these.
Before we go, what are the punitive measures for flouting this law?
So if you are found to be flouting any of these regulations, you can be administratively fined. Yeah, there are charges to some
How
of
much?
these. It depends on the gravity, from as low as maybe 5,000 to, it depends. So
you said as low as 5,000 Ghana cedis? If you're caught smoking in a public space?
If you are caught smoking in a public space, yes, I think if 5,000. If you are caught trading in illicit tobacco products, I think that is quite punitive. You pay about, is it 25,000 cedis, and failure to pay would lead to your prosecution, yes, which we do quite
Please find a better use for your 5,000 and above, and don't smoke in public spaces. But last question before you go, I want you to reiterate the danger of secondhand smoking so that those who can actually take up the fight can do that.
Okay. Thank you very much. So as I said, tobacco has been, research has shown that tobacco contains a lot of toxic compounds, and about 50 to 70 of them are found to be carcinogenic.
Yeah.
And then the smoke that comes out of the tobacco contains all of these toxicants. So we encourage smokers to smoke responsibly. If you want to smoke, locate a DSA, a properly designated area, and then smoke in your closet. Don't endanger the lives of the vulnerable, the innocent ones, or those of us who are not ready to expose ourselves to this smoke. There is no safe limits for the exposure to the tobacco smoke. So we ask that if you can, quit smoking. It is not safe, it is toxic, and it is harmful to the human system.
Jemima, thank you so much for coming.
Much.
How long are you running this campaign for?
It's part of the work we do, but this is to reinforce an already existing law.
Right.
So it's going to be, so as long as we want people to comply. So
okay.
It's part of the mandate.
Thank you so much. Folks, there you have it. Don't smoke in public spaces or else you'll be fined, please. And protect the young and vulnerable so that they don't become second-hand smokers. Jemima Odonko is head for tobacco and tobacco products at the FDA, and she joins us on the no smoke policy or no smoke campaign, trying to create awareness on why you should not smoke in public spaces. Stay with us because there's still so much coming your way. We have our big stories, we have Benjamin Akakpo's blunt thoughts, and of course we have E-Corner with Noella. We'll be right back.